Okay, well, we're going to end with some fun today. Obviously, last week we recapped what the entrepreneurial mindset is, how that's actually present in the intelligence community today, a little bit of storytelling from our alum, Robert. And today, we bring it all together, the whole semester, all these little tidbits and little pieces of gold that you've got from our alum and our speakers who have come in. Now you get to put them to use. What do I mean by that? Today, you get to be the investors. Not monopoly money, not BS, 5,000 real dollars of CFE's money. You decide where it goes. 3 teams are going to come present to you today who were previously awarded from CFE's Fuel program. And you are going to decide which of those teams walks out with $3 grand and the other 2 that'll walk out with $1 grand. Obviously, you've heard from a lot of people who have raised venture capital, from VCs themselves. You have a sense of what we're going to consider, what we're going to kind of patch together as we're listening to them with what makes a viable team, a viable product, a market that's been validated. But I would encourage you to think about those last 2 questions kind of dropped at the bottom there. Why are we doing this? Because you need to know that you're learning by doing. That's what we're going to do today. Tell you a little bit about what Fuel is and why we're doing it. My colleague Allison is going to speak to that for just a second, who I think is behind me. Come on out, Allison. Give her a round of applause. Welcome, Allison.
I need the clicker. Thank you. Hi. Happy Friday, everybody. My name's Allison Smith. I'm a program manager with the Center for Entrepreneurship, and I get to work on programs for students such as Fuel. Now, you've heard what Fuel is. It is a monthly program where students can apply to earn $25,000 of funding for their innovations. Now, the really unique thing about Fuel is it's not a pitch competition. Not to say that it's not competitive, because our judges, true entrepreneurs themselves, are pretty discerning with who can move forward to a presentation and who may or may not get an award. I'm excited that you get to see 3 of our Fuel Award winners today. They will have to condense their pitches a little bit because we have a shorter time today. And after I just told you that Fuel itself is not a pitch competition, today it is. And as Eric said, you'll be voting on the winner. So Fuel runs through the school year. The applications will open again in August. If you'd like to be the first to know when the applications open, Eric will make sure you have the link to the interest form and also to the website. And with that, I'm going to hand it off to our first group, Community Connect. Devin.
Welcome him on stage.
Hi, everybody. My name's Devin. I am a 4th-year PhD student in the School of Education and a former middle school and high school science teacher. One thing I really struggled with when I first started teaching was student behavior. It felt like I was constantly arguing with students to try to get them to do work and assignments. Left me burned out, frustrated, and wanting to quit. And I'm not alone. There's a teaching crisis right now in America, with over half of teachers saying they're thinking about quitting. If you go on teacher TikTok, you'll see videos like this.
I'm walking right out the door. I
Not funny.
do that.
The reason why they're quitting is because these kids are mean and they're making the classroom a war zone.
I also used to think the problem were that students were mean. However, after some time, I realized the problem was really with me and how I was teaching. As soon as I started doing hands-on projects that were connected to students' community, their behaviors and motivations transformed. I went from arguing with students to having some of the most fun, rewarding experiences of my life. However, I also realized that designing community-engaged projects is a pretty heavy lift. You have to think about the standards you need to teach, the student interests that you have in your classroom. You have to come up with project ideas, find community partners, create lesson plans, and all other types of curriculum, all from scratch. That's why I started working with a team to create Community Connect, an online platform that leverages AI to turn what would normally be hours of teacher prep time down to just a few minutes.
All right, hi, my name's Himanish. I'm a computer science student here, and I'm here to talk a little bit about how Community Connect works. So say you're a middle school science teacher who needs to teach a unit on chemical reactions. What you would do is that you'd first log on to Community Connect to create a class. From there, you designate which standards you'd like to teach, as well as the projects and problems that your students are most interested in. From there, Community Connect leverages generative AI to produce project ideas that are both academically rigorous and intriguing to the students. After that, they have the option to partner with a community partner, and they can download lesson plans, unit overviews, and everything else they need for a gold standard education. And to assist us with this, we have this wonderful team with backgrounds in education, business, and computer science.
The way Community Connect makes money is the same way most curriculum companies make money. We actually give our curriculum away for free, and then we charge schools for professional development. This unlocks one-on-one teacher coaching and other administrator oversight tools. Similarly, we let community partners join individually for free. However, we sell enterprise licenses to businesses to help train their employees to make sure that they're ready to go into the classroom. We also provide impact reports to them so they can see how much of an impact they're actually having in their local K-12 schools. There are a lot of AI curriculum companies right now. However, all of these are focused on traditional teaching methods. Community Connect is the only AI edtech company that's exclusively focused on community-engaged, project-based learning. We're planning on launching our platform this summer and getting our first sales. We'll then be looking to raise additional funding in the fall. We are currently a client of Ann Arbor Spark. They provide $3,000 in matching funding for any intern that we would hire. So if we were to win this prize, we would use that money to hire a full-time development intern for the summer to ensure our platform can scale from dozens of users to hundreds. If you know any 6th through 12th grade science teachers in Michigan who are interested in building more transformative classrooms, I'd love it if you could share our website with them, communityconnect.cc. They can learn more about what we're doing and actually sign up for early access beta, which we're launching May 15th. With your help and support, I really believe this platform can become the de facto space every school in the country is using to build more engaging projects for students, transforming classrooms from war zones into spaces students and teachers can love. Thank you so much.
All right, got a question. Nice job, guys. Student questions that came through. How can AI technologies tailor curriculum to the student needs, given that it is an impersonal technology not familiar with the intricacies of teaching?
So one thing that we're really using AI for is the why of teaching. Why should I learn about protons, neutrons, and electrons? And so we actually use other curriculum to deliver the content that students need to learn. And so what they do during their first half of the project is they learn the content, and then we help them apply that to a real-world problem. And that's where generative AI really excels. It is in that ideation of like, how can I come up with something that is intriguing and exciting, and I can see a lot of different options. And so that's, I think, one of the ways that we're trying to do it.
Somebody had submitted a question kind of asking about how AI is familiarized with local issues. Does that answer your question, whoever that somebody is? Silence means yes. Okay. Community Connect, how are you making sure only safe and credible content is generated by AI?
Great question. Again, we're actually not creating academic content. We're using curriculum that is freely available to teachers, Open SciEd, Project Lead the Way, MyStar, CK12, Khan Academy. You can learn content through all of these spaces freely. What we do is we provide that why. Why should I engage with this content? So once I learn this idea, now I can figure out how to apply it in a real-world context with the support of a community partner.
And last question looks like, is this curricular method really targeting the root cause of student meltdowns and classroom troubles?
From my perspective, yes. The why of students, for many of the students that I taught, they did not understand why I should be learning about, like I say, protons, neutrons, electrons. This does not relate to my life. I do not care. So once I started thinking about, okay, what do you care about? How can I connect what we're learning in the classroom to your passions so that you can feel like what you're doing here matters? And we're not just building a prototype that's going to get put on a wall or thrown away at the end of the semester. We're making something that can have a real impact in the community. And once I did that, that's when I saw behaviors, issues changing in my classroom.
All right, thank you very much, Community Connect.
Thanks.
Next group up, Core.
All right, hello. I am here to talk about Core. This is not my slide, but it's very nice. There we go. Came over from PowerPoint, so it's a little weird, but CORE stands for Connecting Research, which is how we're going to democratize the crazy and wonderful field of clinical studies and trials. I wish my team were here today, but they have big boy jobs as almost MBA grads, kidney surgeon, there's Karthik right there, and Amit is our IT professional. So they're very busy, but I'm a lowly computer science undergrad, 1 semester to go, so here I am today. I'm very excited to tell you about the almost 500,000 studies that are posted on clinicaltrials.gov right now. Seems like a huge number, all of which try to advance medicine, develop new therapies, tremendously important. Yet, as with many things, the diversity of these participants actually participating in the trials, especially in underrepresented communities, is far less than the proportion that actually exists. And so we have that level of bias. We also have bias in gender. Even so recent as 1993, most clinical trials were done on men. Even geographically, we have the disparity. As you can see in the different colored areas, depending on where you live, you may have access to vastly different opportunities for this life-changing research. Not to mention that the most common way in which a participant in a clinical trial is connected with the clinical trial is word of mouth. So access to doctors, specialty doctors in big cities, hospital areas is almost the #1 factor in getting into these research. So we have a lack of access. Participants who have rare diseases, who have any kind of disease, can't find research that might improve their lives. We have this lack of diversity, where researchers trying to develop these new therapies are not getting the diverse participants they actually need. And in the case that they are, they're not retaining them. These participants often don't understand the research, fear the research in some cases, and a multitude of other issues. So here's one of those people. This is Pete, the participant, so you can hopefully remember, who has a rare disease, something maybe less than 1% of the population, feels stuck with traditional therapies, gets very scary diagnoses, stuff like that. And Pete needs a better way to find research, while Rachel, the researcher, needs a better way to find people like Pete for a trial. With funding being scarce in this space, finding diverse participants, meeting quotas is very important to continue the research. So they both need to find each other. And that's where we come in. We're going to connect the research. So we want to increase the diversity and the recruitment of these clinical trials. And how are we going to do that? We're going to create tools that do that. It seems a little vague, but really what we're going to do with our tool is match participants to researchers and vice versa. So this is what it looks like. I wish I had a video, but we're kind of on speed mode here. So this is how you can design your study as a researcher. Very intuitive, really for amateurs and professionals. You're going to put in who can be in your study with these colorful icons. And then the system is going to go out with all profiles on our website and continuously search for the people that match, using AI hopefully down the road, but match the most to your study. And as a participant, you're going to be able to discover the studies on your own, see who can participate, if you can participate, and all the information register right on the site. To make it even easier, all you have to do is drag some crazy medical test result. I have no idea what septal wall thickness is, but if you get that from your doctor, you can just upload that to our site. It's going to extract the medical fields and enhance your profile to match you even better. Okay, business time. Sorry, we really are on speed mode here. So studies are very expensive. A 10% decrease in the average study cost will lead to 20,000 additional research studies. And with our Speedline recruitment mode, we are hopefully going to enable something near that. But as you can see, that would spiral out to millions in savings, so the money is definitely there. How we are capturing it, unfortunately, is competing with a vast wealth of competitors. But to summarize this very big slide, none of them really have the matching capability that we do. They are on clinical trials, for example, you are forced to manually sort through the thousands of studies, manually search by title. And that is, again, lack of access and preventing participants from finding research they need. Well, after we defeat these competitors, not really, but we're going to mainly focus on our B2B model, academic centers, hospitals. These are the places funding the big research, pharma as well. They have the deep pockets that I mentioned earlier, and they're always looking to increase the diversity of participants, get more participants retained. As for B2C, we are still exploring this, but perhaps for certain communities, we want to enable a free version, and perhaps for others, or for as a general rule, enable a subscription thing with more matches for more money, but again, we're still exploring that, mainly focusing on the B2B. So what we're doing right now, especially with the prize today, is developing our new web platform. What you saw earlier was a very rickety prototype I made during finals, so it's a little bit falling apart, but we're going to have a very new one with excellent new UI and UX. We're also going to expand to mobile platforms to make it even more accessible to anyone who wants to use our service, and we're continuing customer discovery. A lot of people do not like to talk for free, so especially high researchers, but so that will also support that. And thank you. I am excited to do the questions. This is cool.
All right, good job. All right, students. Throw any questions you've got up on the link there. One of the quick things I wanted to ask is, how big is the market?
Yeah, well, I mean, I can scroll back to the, okay. I'm afraid I'm going to mess up the clicker. I would say, I mean, I am not the business side expert, unfortunately. As I would say, almost every major university is, at least research university, has a huge part of their endowment exposed to research and to finding new participants. Especially, we are focusing as a beachhead market on the rare disease space, specifically oncology, because in those areas, they're often looking for participants that are very young, very less than 1% of kids population, so even harder to find. And they are pouring huge amounts of money, like thousands at least per study, into finding and recruiting these participants, especially because there are extra barriers with parental consent and just the availability in general.
Appreciate that. Okay, we have a student question. Are you worried to continue increasing costs for individuals to find cures for rare conditions?
I almost had the end. Could you repeat that?
Are you worried to continue increasing costs for individuals to find cures for rare conditions?
Yeah, definitely. The B2B is definitely our main focus. I think we're still in the customer discovery phase, and we've definitely interviewed more researchers than participants. I do definitely agree with whoever said that. The customer model is a little counterintuitive because it implies that we're actually adding more barriers to discovering research that could help, find new cures. So we would either enable the big pharma or the big hospitals to provide sort of free licenses or free access to the community, or in all honesty, if we did enough market research to discover we could do away with the B2C, that would be the most ideal method.
Super helpful. Yeah, Allison.
Ethan, could you clarify what CORE would do with a $3,000 award?
Absolutely. I would love to go back to my aesthetic icons. So we, unfortunately, all being students, myself and the other two on my team are MBA students and also working full-time jobs. We would love to have more resources to sort of develop faster while it's really just me right now working when I have time. So we'd love to maybe explore adding new staff or just general development support. Also the main one, the first two are kind of development support, so we definitely pour into that. The last one also, as I said, we are really relying on the market research we've done with the researchers here at U of M. So pouring some of that money into expanding to especially participants that are hard to pin down, that would really give us more of those user personas, as they say, for people using our app would definitely be important as we go forward.
Okay, thank you very much. All right, NeoNest coming up next.
So hello everyone, I am Ananya Bhattacharya. I am a PhD candidate in climate and space science and engineering.
I'm Savani Manimaran, a molecular cellular developmental biology major on the pre-med track.
And we are Team NeoNest. So let's talk about something of a problem which is of a global concern, infant mortality. So what we can see over here is a big chart, and we can see a vast disparity in the global infant mortality rates. So neonates are basically infants which are younger than 4 weeks or about so. And what we can find is that in developing countries or in low and middle income countries, the death rates are approximately 10 times higher. I have been quite fortunate to be born in one of these countries and having being a privileged person, having good health care, to be at this level, but many people in these countries cannot. And therefore, we want to tackle this solution to help the future of the world. And again, we found out that even in the big space of this problem, neonatal hypothermia is leading to 40% of all the deaths around this world, and it's approximately the highest in sub-Saharan Africa, which is leading to about 1 million deaths every year. And if you talk about high-risk babies in ICUs, 80% of them have neonatal hypothermia.
We currently have community partners in Kenya, Ghana, and Uganda, and with over 11 hospitals. And this past spring, I was fortunate enough to be on the travel team to Ghana, where I got to see the shortcomings of some of the infant incubating solutions currently. Over the course of these trips, we've had over 100 stakeholders interviewed, so this includes doctors, nurses, CEOs of nonprofits, to see what issues they have with current infant warming solutions, so we can best work with the community to create affordable solutions for them. The current issues with modern incubators are their high cost. Often a lot of these government hospitals don't have enough money to purchase their own medical supplies and often rely on donations. They're also reliant on electricity and are often non-repairable. For this reason, we've outlined 4 main needs for our community partner. The first being that the bassinet should be visible and have easy access, so that's why we've created transparent acrylic with the porthole access. We also focus on infection prevention. We noticed that during the trip, a single incubator could hold 3 babies, which was really concerning for sterility purposes and inadequate warming. This is why we've created a bassinet that's meant for 1 neonate specifically. We also focus on durability and repairability. And finally, the hallmark of our design is that it's non-electric and mobile. So for communities that may suffer from power outages, this is critical. And we had talked to doctors and learned that from the labor ward to the critical care unit, 80% of babies came in hypothermic, and within the first few minutes of life, this can be very detrimental. We hold a business partnership with Warmaloo LLC, which creates a chemical heating mattress that's integrated within the design of our bassinet. We stand apart from our community competitors in the categories of being non-electric, visible, repairable, and having air filtration. And these are all metrics that we've come up with our community partners to see what issues they have in their current solutions.
So let's talk a little bit about the market size. So the global infant heating market is about $2 billion. And if I talk about especially low and middle income countries, it stands at about 750 million. But our target is sub-Saharan Africa because that's where the problem is highest. That's the root. And again, it's not just about the money and the figures we are here. You know, we can save millions of lives by doing this. It's about the bigger picture at the end. So for our go-to market, we will first go to Kenya. The reason being is that if we try to do it through FDA, it's going to cost us millions of dollars, tens of thousands of dollars. But if we go to Kenya, because that's where the problem is, then we can get it done within 20 or 30K in terms of regulatory approval and clinical trials. And again, Kenya is also the gold standard in African region. So once we have approval over there, we will try to expand in Uganda and Ghana, where we already have strong community partner relationships. So this is our business model. We have a B2B and a B2D. So we can directly give it to the hospitals, and also we can distribute it through medical device distributors like VIA Global Health, and work with NGOs like Bill and Melinda Gates Foundation to reach it to people who actually, are in these scarce regions where, let's say, we don't have access to electricity, things like that. And we have a very diverse team. Unfortunately, our founders could not be here. They're currently in Ohio and conquering some other challenge. I'm sure they'll win that. But we have a very diverse team and a very diverse group of mentors who have actually been in this industry and have been operating in the sub-Saharan Africa region for more than 10 years. And they also have quite a big experience with regulatory approval in this industry. And we represent the EHour team, myself and Sivani. So it's a student organization in University of Michigan. We are a group of grad students and undergrad students. So, if you're interested in joining our mission, feel free to shoot an email. And here is our financial breakdown. That is, we want to distribute it half and half for prototype development and clinical trials preparation. As my friend said, we went to Ghana and we got a lot of feedback. And from that, we will improve our prototype from version 2 to version 3. That was in the first quarter. And in the second quarter, we want to go for clinical trials in Kenya so that we can start selling by the beginning of next year, probably. And again, this is the broader goal. We want to help create a world where every baby can flourish, irrespective of where they're born. So, if you want to join our mission, then shoot us an email, and we would really be happy to get in touch with you. So with that, I'd like to welcome questions. Thank you.
All right, thank you. Okay, we got a couple questions, so you might want to answer pretty quickly. There's a couple to go through here. How much will clinical trials cost in Kenya, and what is the timeline for regulatory approval?
What is the timeline of?
How much will clinical trials cost in Kenya, and what's the timeline for regulatory approval?
It's 20 to 30K for clinical trials, and I think to go to the approval process, there's extra $1,000. And I think the approval takes about 9 to 12 months. That's currently what we know from the estimates, and we have a strong community partnership. So once we conduct these trials, we'll get the data sets and give it out to the Pharmacy and Poisons Board, which is the equivalent of, the same organization in Kenya, and they will go through the process, and that's the process of getting approval.
Next question, how dependent is your technology on Warmaloo?
It is pretty much dependent, but we have a really good business partnership. We are also improving our technology, and that's going to be then the future plan. I don't know if I can share some supplemental slides. There's a lot of details. I'm sorry you have to go through that. But yeah, we have all these plans, and we want to improve the technology. It's somewhere over here. I'm so sorry if it's getting lost.
And
but
with the main competitive advantage being that it's non-electric, the partnership is strong, and that's how it stands out from other companies that may be making affordable incubators.
Okay, sounds good. Couple more. How are you performing air filtration?
We're currently we have ventilation holes, but we're currently conducting both physical testing and doing simulations through COMSOL to better determine the size and placement of the ventilation holes.
Have you patented the technology, and can it be easily replicated by larger companies?
No, we are pursuing patent application for that for sure, and we are improving our prototype. And at the same case, we are clients of the Zell Entrepreneurship Clinic, so we have some sort of representation. So we are already working on that right now.
Okay. What's profit margin on each unit?
Sorry?
What's the profit margin on each unit?
Profit margin. So I exactly forgot about that. I think it should be around. It's related to the business operations because Neonest is a non-profit, by the way. So that's what I wanted to clarify. I think it should be around 20-30%, but I think my co-founders can give you a better estimate on that one.
Sounds good. And this one, do you have studies showing that this product would align well with the needs of NICU units, such that these would easily integrate into replacing existing technologies?
That's why we're working hand in hand with our community. So it's not like we're creating a solution and giving it to them, but we're working with them in the prototyping phases, which is why we go on these trips and value those customer discovery interviews, which we have over 100 at the moment.
Give them a hand. Okay, students, great questions. Well done. You clearly are going to be future VCs. Please be kind with the money that you distribute. All right, Ian's going to kick it over to this slide that pulls up our QR code for voting. If I had the Jeopardy music, this is where we're going to start playing it. I want you to decide who should take home $3 grand to advance their company. Okay, thank you, everybody. Can we get a drum roll going? You guys, yeah? Nice, nice. All right, winning team, Neonest. Neonest takes it home. All right, come on up. Get the big celebratory check. Yeah, come on up, you're good. Absolutely. That is such a big check. Also, congratulations to Community Connect and Core, well done. Take home $1 grand, that's not too shabby for a Friday. All right, students, thank you so much for participating today. Thank you for demonstrating what you've learned in real time. Please give everybody a round of applause, and especially our winners, Neonest. Jeb. Okay, as much as I would love to stay with you here and hang out next Friday and the Friday after that, it's the last one of the semester. Come on back in the fall if you want, bring a friend. Thank you, everybody. Have a good weekend.